Good morning, everyone, and welcome to the Careers in Pharmacy webinar as part of our Science Week celebration. Today we are joined by Clement Surina from King's College Hospital, who is going to talk about different roles within pharmacy, where you could work as a pharmacy professional, entry requirements, and much more. So please make sure you ask Surina some questions to get the most of your time. And to do this, you can use the chat function on Teams or unmute yourself at the end of the presentation. Over to you, Surina.
Thank you so much. So my name is Serena and I am a pharmacist. So I'm going to provide you a bit of background about why I went into pharmacy, why I chose pharmacy as a career, and I'll later discuss what my role entails, what responsibilities I have, and my career to date. And then I'll share with you a few slides as well, which will give you a bit more background knowledge on the different roles that there are within pharmacy. So the reason that I chose pharmacy was because I really enjoyed science, particularly chemistry, and I wanted to go into a career where at the end of it, my degree, I would end up in a job. I just didn't know what role would be right for me. I also wanted to be in a role where I could help patients as well. And so I guess for many people, that option could be then medicine. I have many medics in my family, many doctors, and seeing that lifestyle, I realised that wasn't really the route that I wanted to go down. And so I didn't really know what I wanted to go into. And pharmacy came up as an option. So I decided to do a placement. And it was on that placement where I really got to see what roles and responsibilities that the pharmacist had. This was in a community pharmacy. And also the relationship that the pharmacist had with his patients. He knew their names, he knew all about them. He was able to have a really great rapport with the patients and public that he had around him. And I also got to see with the support staff as well within the pharmacy and the role that they too had and what roles they had as well. And upon speaking to the pharmacist just to get general advice from him, we were discussing further and he told me that he was a DJ in his spare time. I thought that was pretty cool, pharmacist during the day and DJ by night. And it really highlighted to me the work-life balance that pharmacy can provide you with. And that was something that was really important to me. So I decided to pursue the career and very happy that I did. And I completely understand how overwhelming it can be to consider what is it that you want to do, what job is right for you based on the skills that you have, based on the passions that you have. That is a really tough question to answer. But hopefully by the end of this presentation, I can give you a bit more guidance on the different roles that there are within pharmacy as a profession. And maybe that will inspire you to either pursue this role or maybe even go on placements or seek out other opportunities that there are. So I think it's quite important to highlight what a pharmacist actually does. So if any of you have been into a pharmacy, you may have given a prescription to someone within the pharmacy team, and they may say to you that actually you have to wait about 10-15 minutes for us to process your prescription. And you might think, why does it take 10-15 minutes to do that? It's a piece of paper that I've given to them. They just need to give me the medicine and I can go on with my day. And I don't blame you for thinking that, because that's exactly what I used to think as well. But actually, when a prescription is handed to the pharmacy team, the pharmacist will do what is known as a clinical check. So they are firstly checking that that medicine is right for you, based on your age, based on any other conditions you may have, based on any allergies. Pharmacists double check doctors' work because sometimes doctors don't always prescribe the most appropriate medicine, or they might prescribe something which is actually currently out of stock. And so the pharmacist will advise the prescriber, the GP, for example, that maybe give this alternative instead. This will work just as effectively, and they'll give them additional points guidance through that as well. And then once the pharmacist is happy that the medicine that the doctor has prescribed is right for that patient, it then gets processed and generated. And in that time, the pharmacist may also be dealing with other queries that are happening within the pharmacy. They might be counselling patients on a new medicine that they are taking. They might be providing an additional service. They might be helping a hospital query that has come through. And once the medicine has been processed by, for example, a pharmacy technician or by a dispenser, the pharmacist will then do a final check to make sure that, yep, this definitely is the right medicine for this patient. And then when they give it to the patient, they will make sure that they give them the most appropriate advice. So that's what happens within community pharmacy. There are so many services that a pharmacist can provide, and especially we're finding now a lot more responsibilities being given to pharmacists as well and to pharmacy teams. So, for example, during the COVID pandemic, pharmacists were giving out the booster vaccines. Pharmacists also give out flu jabs, travel vaccines. They are a point of call for advice if somebody wants to stop smoking, for example. They're very much at the heart of the community, and that's why they're known as a community pharmacy. And there are many different types of community pharmacies as well. And when we think about pharmacy, I think it is very easy to go down that rabbit hole and just think community pharmacy is the only option. And here today, I'm going to present to you so many different options that there are within pharmacy. There's hospital, there's industry, and we'll explore each of these in a bit more detail. Whilst my background is in community pharmacy, so I worked in many different pharmacies within the community, so some that were in high streets, some that were in supermarkets, some that were smaller family-owned independent pharmacies. I've then went on to work more in the education space, and that's where I work now. And later on in this talk, I'll give you a bit more information about the role that I currently do. So I'm going to share with you some slides that have been put together by the team, and we'll discuss this in a bit more further detail. So I'm hoping that you can all see this okay. If not, please do just let me know. So are you considering a career about pharmacy? And if you're keen to help others, you enjoy science and you want a career in healthcare, then pharmacy could be just right for you. And that's what I found with myself as well. I was able to bring together my passion for science, this need of wanting to help people, and bring that together. And pharmacy allows me to do that. So there are many careers within pharmacy, and it offers a chance to really make a positive impact and difference on people's life and well-being. And this includes both physical health and mental health. And you can do so in a wide range of settings, which we'll look into now. There is this video, which I'm hoping will play all okay and you'll be able to hear. If not, please do let me know.
Surina, we can't hear
Yeah.
it. I think maybe, have you tried, when you shared your presentation, did you click share audio?
Oh, it didn't give me that option.
Oh.
What I can do is, because we'll be sharing these slides anyway,
Yeah.
it might be easier for individuals to have a look at the videos themselves.
Yeah, we can do that.
No
Yeah,
problem.
cool.
So this video was just going to go into more about the different careers that are within pharmacy, but do take a look at this in your own time, because it is a really nice way of capturing the different roles and responsibilities that there are. So if I move on. So there are three main staffing groups that are within pharmacy. You have your support staff. So this includes, for example, your medicines counter assistants and your dispensing assistants. And if we think about with community pharmacy, this is usually the first person that you will see within a pharmacy. And the name kind of says itself, medicines counter assistant. It's the individual that will be behind the medicines counter. There are many courses that are available now that actually merge the ability to be a medicines counter assistant and a dispenser together. So the medicines counter assistant is almost the front facing. They're the ones that you will interact with directly. They might give you advice if you require any medicines that are behind the counter. For example, if you have any infections on your feet, for example, they can provide you with advice. If you've got any pain, if you're experiencing a bad cough or cold and you want something to help soothe that, your medicines counter assistant will be able to advise you on that. Your dispensers, they work sort of behind the scenes, and they help support the pharmacy technicians and the pharmacists with dispensing different medicines. So there, as I mentioned, there are now courses available which actually combine these two roles together, if that was something that was of interest to you. You also have your pharmacy technicians, so they are essential to the smooth running of pharmacies, and they make sure that patients get the most out of their medicines. Pharmacy technicians, they manage the supply of medicines and devices in a pharmacy and assist pharmacists with advisory services. And with the pharmacists, they use their expert knowledge of medicines and health to provide care to patients with all types of health conditions. So whereas GPs are experts in conditions, pharmacists are experts in the medicines and in knowledge of those medicines, and therefore can give the most appropriate advice to patients based on what medicines and devices they are taking. So where could I work as a pharmacy professional? So I mentioned within hospital. So as a hospital pharmacy professional, you'll work within a large team. So this will be with nurses, with doctors, with all different healthcare professionals. And you might decide that you want to specialise in a particular area. So this could be to do with the heart, known as cardiology, or this could be in child health, such as paediatrics. You may do further qualifications where you can then act as a prescriber. So you can start prescribing medicines, and you can do this in both a hospital and a community setting. So you might review patients' medicines, you might prescribe them new medicines if required. You might also look at the medicines that they're currently taking and think, actually, is this particular medicine giving them any benefit anymore? And if not, you can do something called deprescribing, which is taking them off those medicines. And you make sure that patients are not taking too many medicines or are suffering from any unnecessary problems. You may attend ward rounds with a team made up of different healthcare professionals, or even run specialist clinics for patients. Community we've already spoken about, and they are situated in the hearts of cities, towns and villages, and you'll be involved in assessing conditions, dispensing medicines and offering advice to patients and the public, and play a really key role when it comes to promoting health and well-being within the community. You'll also be involved in managing long-term conditions or delivering flu vaccinations. You could manage your own business, or you could work for a chain or a high street pharmacy or a supermarket pharmacy, each with its own rewards and opportunities. So within pharmacy, you might decide that actually you want to know more about the business side. So you might work towards becoming a pharmacy manager, a store manager, area manager, regional manager. There are so many opportunities to grow into all different types of roles. Decide that you want to work within industry. So here you could work in companies that manufacture medicines, for example, or you could be involved with clinical trials, discovery and design of new medicines, or develop papers which evaluate the safe and effective use of a medicine. Some pharmacy professionals go on to work in more commercial roles or marketing or sales roles even. So again, it's making you aware that there are all these different roles that are available within pharmacy. It's quite easy to maybe have that misconception that it's just hospital or it's just community, but actually there are so many different opportunities out there. There's also roles within academia. So working in a university, for example, you might decide that you want to go on to do a PhD and work as a lecturer, as an example. So there's, again, roles for you can always further your development. We might decide to work in general practice, and this is an area which we are seeing a lot more people go into, pharmacy professionals go into within a GP practice. So again, they might do additional qualifications so that they can prescribe medicines, and they might review patients' medications, what long-term conditions they're on, and even run specialist clinics to help manage certain conditions such as asthma and diabetes. Or you might decide that you actually want to work for a clinical commissioning group. So this is an NHS organisation that buys in hospital and community NHS services for the local population. And as a CCG pharmacy professional, they are involved in making sure that patients receive the right medicine based on the most up-to-date guidelines. And they're also involved in looking after a group of GP surgeries and helping them stay within their budgets they allocated for prescribing medicines for their patients. And the list goes on. So you might want to work within technical services and clinical trials, work within research, work in care homes. So pharmacy professionals can work directly in a care home, or they might work in a pharmacy that is affiliated with a care home. And that's something that I have experience with. Before that, I didn't really know much about the running of care homes or the responsibility that those in a care home had. And actually the relationship that is between the pharmacy professionals and the care homes is a really important one in making sure the patient is best supported. You may decide to go through and work in procurement or within health and justice. So this could include in prisons, in immigration removal centres, young offenders institutions and secure children's homes. So making sure that any patients or individuals that are within these settings, that they still have access to the medicines that they may require. Or work for NHS 111, which provides 24/7 care to the public simply by dialing 111. And as a pharmacy professional, you will work alongside GPs, paramedics, mental health nurses, and more. And what we find with a lot of individuals now is that they do something called portfolio work, which is that they don't necessarily stick to one area of work. They might, for example, for 2 days a week, work in a GP practice, and then for 3 days, they may then work in a community pharmacy. Or equally, they might work 1 day a week as an academic pharmacist, so presenting in a university, and the rest of the time they work in a hospital pharmacy. So more and more people are actually doing these roles where they're working part of their time in one sector and the other part within another sector. Or you might decide to go into mental health pharmacy and work within a mental health trust. So pharmacy professionals and mental health work closely with patients, as well as all different members within a multi-professional team. And they make sure that patients receive that ideal medicine to improve their mental well-being. Treatment is often complex, and it's also important to consider physical health conditions as well, and what the patient wants when advising on therapy. And there's even more opportunities. So education, as I mentioned, is an area which I'm currently working in. And when I was doing my undergraduate degree as a pharmacist, I didn't really know what opportunities there were available within education and pharmacy. I knew that there was academia, so working as a lecturer, but that's about as far as I knew what was aware. The role that I'm currently in right now looks at the pharmacy degree, and it's a role that's only actually existed for less than a year. And there are many changes that are happening in pharmacy, really exciting changes that are happening to make sure that individuals who decide to do a pharmacy degree, they have more opportunities to have hands-on experience and more placements. So what my role is to look at how can we make sure that that actually happens for individuals, for students, and looking at, I guess, the behind the scenes of what needs to change and what needs to happen to make sure that this actually flourishes. And as I mentioned, this role isn't even a year old. I started this role last May. And so it really goes to show that pharmacy is ever changing, and there are so many different opportunities that do crop up and that do pop up. It's really a case about seeing what you're interested in and how can you use your interest to carve out a career that works best for you. So what are the different routes to becoming a pharmacy professional? So if we start off with those pharmacy support staff, so our dispensers, our medicines counter assistants, those first people that you'll probably see in a community pharmacy, for example. Well, these individuals are not registered with the General Pharmaceutical Council. So if you are a pharmacy technician or if you are a pharmacist, once you have completed all of your training and done all of your exams, you will then be registered with the General Pharmaceutical Council, or GPHC. And that basically means that you meet all the requirements and all the standards that there are to make sure that you can practice as a qualified professional. With dispensers and with medicines counter assistants, because they don't need to undergo as extenuous training as a pharmacy technician or a pharmacist does, they are not registered with the GPHC. So the appropriate minimum level of knowledge and competence for pharmacy support staff is Regulated Qualifications Framework Level 2 or Scottish Credit and Qualifications Framework Level 5. And it's to start support staff training, an individual must be employed either full-time or part-time in a pharmacy. And this is because the training is vocational and requires knowledge to be demonstrated in practice. So you'll be earning and learning at the same time. And particularly if you think maybe pharmacy is a profession for you, but you're not quite sure what route you would want to go into, this can be the first step into seeing what opportunities are there for you. But what if you want to become a pharmacy technician? So as mentioned, pharmacy technicians, they are registered with the General Pharmaceutical Council, and it usually takes about 2 years to complete all training. And it combines practical work with study, either as a distance learning or a college-based course. And to qualify as a pharmacy technician, you need to complete a GPHC, so a General Pharmaceutical Council approved integrated competency and knowledge-based qualification or course, and register with the GPHC. So there are many GPHC approved courses available to be a pharmacy technician, but they will all need to meet a set standard to make sure that they are approved by the GPHC. And as mentioned, it takes about 2 years to complete that. The entry requirements will vary depending on the course provider. As a guide though, usually you need an equivalent of 4 GCSEs at grade C and above, including maths, English language, science and one other subject. You'll also need to be working in a pharmacy under the supervision of a pharmacist or of another pharmacy, a qualified pharmacy technician. And as mentioned, to practice, you'll need to be registered with the GPHC. There are apprenticeship routes for both those that want to go in pharmacy service assistant roles and those that want to go into a pharmacy technician apprenticeship. So with the pharmacy service assistant apprenticeship roles, it's usually a minimum of 12 months, and these apprenticeships tend to be funded by your employer. So again, you earn whilst you learn. With a pharmacy technician course, this again, usually the apprenticeship takes about 2 years. In both situations, you will need to build up a portfolio of evidence. You'll need to complete certain workbooks and assignments to gain that knowledge and demonstrate your competence. And once you have completed your portfolio, you will complete an endpoint assessment. And you may need to complete functional skills alongside your qualification, depending on your current educational qualifications as well. So these are other routes that you can go into, the apprenticeship routes, to be a pharmacy services assistant or a pharmacy technician. And if you wanted to go into pharmacy and if you wanted to be a pharmacist, you need to complete a 4-year Master of Pharmacy or MPharm course. And once you've completed those 4 years, you then get your qualification, you have your MPharm degree, but at that point, you're not actually a pharmacist, you're a trainee pharmacist. You then need to complete an additional year known as the foundation training year. And once you complete 2 exams at the end of that training year, do you then become a fully qualified pharmacist with the GPHC. There are some universities that do offer 5-year sandwich courses, which includes a year in the workplace within that space. So it's really about finding what works for you, whether you would want to go through that route or if you want to do the traditional 4 years of your pharmacy degree and then do your year in training after that. Within England, Wales and Scotland, you would do a GPHC registration assessment, which is those 2 exams at the end. And in Northern Ireland, it's a GPHC and PSNI, which is the Pharmaceutical Society of Northern Ireland. They organise the exam. The exams are all the same, though, for wherever you're situated within the UK. It's just different regulatory bodies that organise those assessments. So those 2 assessments, one of them is more of a clinical exam, the other one is more of a calculations exam. And you are likely to need 3 A-levels or equivalent qualifications at level 3. And entry requirements for pharmacy degree courses will vary because each university sets their own criteria. So if there's a particular university that you want to go to, have a look at what their entry requirements are. You'll need GCSEs or National 5s in English, Maths, Chemistry, and at least one other science. And as mentioned, you will be registered with the General Pharmaceutical Council as well. So pharmacist roles are constantly evolving and changing, and there are more and more responsibilities that are being given to pharmacists because of the expertise that they have. And many of the experiences and skills you develop in practice can be transferred to other pharmacy environments and roles. So I started off in community pharmacy, but now I work in pharmacy education. So I was able to use the experiences and skills I have to actually move across to a different area of practice. For instance, there is military pharmacy, for example, so military pharmacists who work in the Navy, Army and Air Force, and some of them are also service personnel and undertake additional required military training. So can you progress from being a pharmacy assistant to a pharmacist? Well, you can progress from being a pharmacy assistant. Once you've got that qualification and experience, you can then apply to be a pharmacy technician. However, if you are a pharmacy technician, you can't then necessarily make the jump to a pharmacist. You would still need to do the full MPharm degree programme and followed by that foundation training year in a paid work placement in order to then become a qualified pharmacist. But you can see that there is a way that you can grow within pharmacy and find actually what role actually really suits you and your skills and experience. There is another video, but please do watch that in your own time as it gains you more insight into what it's like working in a hospital setting. In terms of work experience and placements, you might be able to gain experience involving direct observations or areas of practice such as community pharmacy, care homes, GP practices. This isn't essential, but if you can gain an insight into what it's like working in those settings, it may be able to give you a more hands-on experience of what it's actually like working there and what it's actually like working as a pharmacy assistant, support staff, technician, or as a pharmacist. And I believe you do get access to these slides. So there's a test that you can do as well. Do have a look at that as well as the resources on this slide for further information. The NHS does need more pharmacy professionals. Pharmacy professionals within healthcare teams are important and more important than ever. As the population is getting older and older and people are living longer, people are also living with chronic long-term conditions longer as well, and they require careful management. So this means there is a great demand within the health service for pharmacy professionals with expertise in medicines to manage increasingly complex modern medicine treatments. There's another career quiz that you can have a go at as well when you get access to the slides. And there's loads of resources that are available if you do think this is an area that you want to explore more. One particular link that I would really advise that you look at is the second one here, which says the Interactive Careers Map, which is a really nice way of displaying all the different routes that there are in pharmacy. It gives you more detail about each of those different routes as well, especially some of the more obscure areas which maybe you didn't think of beforehand. So do take a look at that. And so I'll stop sharing at that moment. And if there are any questions, please do feel free to ask.
Thank you, Serena. That was very informative.
No problem.
Do we have any questions? I wanted to ask Serena, what motivated you to transition from one area of pharmacy to from community, hospital, now education?
Yeah, so what motivated me was when I was doing my MPharm degree, I was really inspired by my lecturers and the way that they were able to take really complex concepts and break them down into more manageable chunks. And that was something that I could see myself doing. I just didn't know what routes there were in order to do that. When you do your foundation training year after you've done your degree, you have to do that within either a community or hospital setting. Some opportunities do provide within industry as well. And gaining that community experience really helped open my eyes up to what patient ailments there are, what conditions there are, and what it really takes, those roles and responsibilities to be a pharmacist. And I thoroughly enjoyed my role as a pharmacist in communities, especially building that rapport and relationship with patients. But in the back of my mind, I still always had, I do want to get into education because that inspiration that came from my lecturers was still inside of me. And it was an area that I really wanted to explore. And it was really a case of just looking at what was out there, what was available for me to try and tap into. So I went on to work at the National Pharmacy Association, which is a membership body for community pharmacies. So they support community pharmacy professionals with different courses that they have, facilitating in training days, and they have so many different opportunities that were in there. And I worked as a learning and development pharmacist, and it was really my first insight into what education requirements are within pharmacy, or I guess what happens in the background that maybe you don't realise when you're doing within your degree. And I realised that was the right step for me, and so it's just kind of been a natural progression into the role that I'm in now to continue within pharmacy education and just try and give that foundation to those undergraduate students and support them as best as I can. And I do a lot of work outside of sort of my normal working working hours, which goes towards supporting those that are interested in pharmacy, those that currently do their MPharm degree, and also trainee pharmacists as well.
That's great. Thank you. And is there any ideal profile in terms of skills, qualities, and personality that you would look for in someone who's aspiring to work in the sector?
Yeah, so I think that there's quite a few skills that would make a real ideal candidate, whether they want to be a pharmacy assistant or they want to be a technician or a pharmacist. The first one would be passion. So passion for wanting to help people, wanting to care for people, wanting to help their health needs, and interest in medicines as well, and how one medicine can make somebody feel better, but actually how another medicine may cause a side effect in a patient, for example. Having that passion and curiosity together is something which would be ideal to have. Also having being proactive as well, so wanting to see what opportunities are out there for yourself. Again, it goes into feeding that curiosity. What else would be really beneficial is, and this isn't an essential skill, but would really help, is demonstrated communication skills as well. Especially if you're in a pharmacy role that is patient facing, you will be talking to patients all the time. So making sure that you have that ability to communicate with patients, that ability to empathize with them, listen as well. All of these skills are really, really key. And even if an individual feels like these skill sets maybe aren't as strong right now, actually by going into the profession, people around them will help them support to be able to develop those skills further. So I guess going back to having that passion and curiosity, those would kind of be the really key skills. And everything else, if you have that curiosity and you can feed that curiosity, then all those other skills can be developed further.
Absolutely, I agree. I mean, some things cannot be acquired, but skills like communication can be improved a lot. But having that curious attitude is probably a personal quality.
I agree.
That's great. Thank you so much, Surina, and thank you everyone for watching. I hope you have enjoyed it.
If there are any further questions, then for anyone that's watching it, I am happy to answer them offline as well. I can send across to you my contact details if you want, and then you can share them, or if you're happy for me to say them on here, I can say them.
Yes, absolutely. Oh, we have a question. How many students attended?